Patient Instructional Video, Proper Application and Removal of Scleral Lenses. Congratulations on your new scleral contact lenses. This video was designed to assist you in the proper application and removal of your scleral contact lenses. It is important to follow your eye care practitioner's instructions for the proper use of scleral contact lenses, including the proper use of the lens care products you were prescribed. Should you experience redness of the eye discomfort or irritation, changes in your vision, and or excessive tearing while wearing your scleral lenses, remove your lenses immediately and contact your eye care practitioner. The application and removal of your scleral lenses can seem intimidating at first, but if you follow these instructions, the process can be quite simple. Let's get started. Proper hygiene. Proper hygiene is the first step in successful lens care. Wash your hands with a mild soap and dry your hands with a lint-free towel prior to handling your scleral contact lenses. Lens handling and inspection. Getting in the habit of working with the same lens first will help you to avoid mixing up your lenses prior to applying them. For example, if you're right-handed, you may want to start the lens application process with the right lens each time. Starting with the right lens, carefully remove your scleral lens from the storage case. Ensure that your lens is clean, clear of any lint or debris, and that your lens does not have any chips or cracks. Rinse the lens with a fresh preservative-free saline solution to remove any residual storage solution that may have preservatives in them. Applying your scleral lens. Place your scleral lens on 2 or 3 fingers by forming a tripod with your thumb, index, and middle finger. This will make it easy to keep the lens balanced. Fill the entire bowl of the lens with preservative-free saline. Position your head parallel with the countertop or table and look straight down. To apply your scleral lens, you will need to separate your eyelids in order to position the lens on the eye. This can be accomplished by using your free hand to pull the upper lid up and the ring finger of the hand with the lens on it to pull away the bottom lid. Slowly move the lens toward the eye. Gently apply the lens directly on the eye and over your pupil. Release the lids and blink several times to clear the excess fluid. The lens will automatically center. Inspect the lens on the eye to make sure there are no air bubbles trapped under the lens. If you notice an air bubble trapped underneath the lens, you will need to remove the lens and reapply it. Applying your scleral lens using a DMV Scleral. You may use a special device called a DMV Scleral to support the lens for application if desired. However, you should consult with your eye care practitioner prior to applying your scleral lenses with the DMV if it was not prescribed at your lens dispensing office visit. The application process with the DMV Scleral starts by lightly squeezing the tapered handle so you create a mild suction. Carefully place the scleral lens on the top of the DMV, making sure it is centered. When the lens is centered on the DMV, stop squeezing the device. This will create a suction and your scleral lens should be securely positioned on the DMV. Completely fill the bowl of the scleral lens with a preservative-free saline. Position your head parallel with the countertop or table and look straight down. To apply your scleral lens, you will need to separate your eyelids in order to position the lens on the eye. This can be accomplished by using the index finger of your free hand to pull up your upper lid, while using your middle finger to pull your bottom lid down. Slowly move the lens toward the eye. Gently apply the lens directly on the eye and over your pupil. Once the lens is on the eye, a light squeeze of the tapered handle will release the lens from the DMV. Release the lids and blink several times to clear the excess fluid. The lens will automatically center. If you notice an air bubble trapped underneath the lens, you will need to remove the lens and reapply it. Wash the DMV frequently in warm soapy water and let air dry. Removing your scleral lens with the DMV 45. The DMV 45 has a 45-degree angle which keeps the fingers out of the line of sight while removing the scleral lens. Wash your hands with a mild soap and dry your hands with a lint-free towel prior to removing your scleral contact lenses. Looking at the mirror, take the index finger and press with the lower lid into the white of the eye, just below the lens. When the suction is broken, a bubble will be present under the lens. This lens is now ready to be removed with the DMV 45. Looking in the mirror, pull your lower lid away from your cornea to expose the lower edge of the lens. Once the DMV 45 is adhered to the scleral lens, gently pull the lens away from the eye. With the lens resting on the DMV 45, gently move the lens off the device using your thumb and index finger. Follow your practitioner's lens cleaning instructions once the lens is removed. Place your lens in the correct side of the contact lens case and repeat the removal instructions for your other eye. Wash the DMV frequently in warm soapy water and let air dry. Proper lens care for your scleral lenses. Your eye care practitioner will review the proper lens care solution for cleaning, rinsing, and disinfecting your scleral contact lenses. Refer to the lens care package insert or call your eye care practitioner with questions regarding the proper care of your scleral lenses. What should I do if I lose or break my scleral lens? Having a backup scleral lens will eliminate any unforeseen circumstances by losing or breaking a lens. More importantly, your vision will be uninterrupted. Talk to your eye care practitioner about the importance of having a backup or spare set of scleral lenses. Please consult with your eye care practitioner with questions about your lenses. Thank you.